Hi, I'm Steve Jacobson. I'm a family medicine physician. I've been in practice for over 30 years, and I'm delighted to be on the panel today for talking about COVID-19 vaccines. And I'd like to introduce you to my partner, Jaylyn, who's also on the panel today.
Thanks, Steve. It's great to be here. I'm Jaylyn Pritchard. I'm also in family medicine, a fewer years than Steve, but I've got 3 kids at home who are elementary school aged, and I'm excited for our conversation. Yeah, it's been a little bit of a hard year for lots of people, but we do have a vaccine, and that's great news. The purpose of the vaccine is really to try to teach our immune systems what COVID is. And when our bodies haven't seen something, sometimes it can learn quickly how to respond, but other times it needs a little bit of help. And the COVID vaccine is just that. It's a little bit of help for our bodies to learn how to respond should we be infected with COVID in the future.
Community immunity, or herd immunity, they mean the same thing, is the percent of people in our population that are immune to the virus. And that could be, the population could be our city or our county or our state, and it's kind of looked at in different ways. The higher the percentage of people who are individually immune to the virus, the less likely the virus is to spread. So the more we can be vaccinated, that helps decrease the chance of spreading the virus and improving our herd immunity. Now, it could be that somebody's already been infected with the virus and they develop immunity naturally, or they could be given the vaccine, and either of those count toward the term herd immunity.
Vaccines work in a number of different ways. The point of them is to try to help and teach our immune system how to respond to a virus, a bacteria, or some sort of foreign invader. And so the COVID vaccines currently in the United States, all of them are working to try to help create a protein inside of our bodies that acts as a protectant or an antibody, so that when we see a virus or bacteria, in this case the COVID virus, our bodies are adaptable and able to protect us from a severe infection. We were guessing that a good vaccine for COVID would be maybe 60 or 70% effective, and we actually have data that's better than that. So any of the vaccines will do the job that they need to, and essentially that means that they'll reduce the risk of severe COVID infection resulting in hospitalization, and they reduce the risk of death. Some vaccines take more than one dose of the vaccine or more than one exposure to those proteins in order to teach our cells how to adequately respond. So the mRNA vaccines like Moderna and Pfizer need 2 lessons for our body to properly respond, and the Johnson & Johnson vaccine only needs 1. There's a good chance that people who choose not to get the second dose, whether it's convenience or access, or maybe they had a side effect to the first vaccination, will have some degree of immunity. But we don't know how long that will last, and we don't know how dependable that will be. Remember, the point of vaccination and herd immunity is to try to get a certain percentage of the population predictably vaccinated and protected from severe infection. With only one of the 2 doses, there is a lesser chance that we'd have a dependable antibody response that we need to reach herd immunity.
Yeah, a big area of concern is what about the mutations of the virus? And the term that's often used for that are the variants. There's ongoing studies to ask that exact question about what the variants will do, and some of the new vaccines are being specifically looked at against the different variants.
It's a warning to heed that viruses mutate when they're allowed to spread in communities. And so I think it's all the more reason to get vaccinated earlier than later, just because the more people that are immune to COVID, the lesser chance we have of seeing huge mutations that are community-wide, which may eventually make the vaccines less effective.
Yeah, there's been a lot of work looking at the question of COVID antibodies and what the natural immunity is. And so, a good part of the country has already had the COVID infection. However, there's really good evidence that shows the natural immunity that our bodies develop isn't as good as what the vaccines can provide. So even if you have COVID antibodies and have had a prior COVID infection, I'd still recommend you get the COVID vaccine. And one of the types that are available, and that provides stronger and longer lasting immunity. We think it's going to be pretty good at least for a year longer. It may be that there is a booster needed. Could be a year down the line, could be 2 years, probably all that yet to be determined, but likely there'll be some kind of a booster series that will be needed.
One of the most common questions I'm getting from patients is, do you think they'll ever just add this to the flu shot?
There's a lot of nuances to vaccine science, and some vaccines fit very well together. Perhaps in the future, the flu vaccine and the COVID vaccine could be given together, but I think it'll have to be determined on that one.
Safety continues to be, I think, the biggest question on people's minds. And the FDA, so our Food and Drug Administration, goes through a fairly rigorous process with very highly trained and knowledgeable experts that are collecting data and reviewing data. What we're trying to do through vaccination is not only try to keep people healthy, but we're trying to reduce the burden of the hospitals and the healthcare system in general. And we're trying to reduce the number of people that have died, so the mortality, or the people that remain sick, those long haul COVID symptoms. So the safety of these vaccines in general is really vetted through a fairly rigorous process in order to get them to market. So side effects from the vaccine are somewhat predictable, and they can be muscle aches, injection site reactions with a little redness and soreness where the injection was, chills, myalgias, which are kind of more severe muscle aches, fatigue. We're really seeing most of these come about within the first 24 to 40 hours after vaccination. And for most people, they're completely resolved in about 48 to 72 hours after each dose of the vaccine. My encouragement to my own patients has just been to pay attention to the safety data. They're actively reporting side effects and data on the vaccines like we've never ever seen before, that's completely open to public viewing and to the public eye.
I think the scrutiny on this, on the safety of these vaccines, is probably about as great as any vaccine that's ever been developed. And the transparency is also, as you were saying, there's a lot of good information out there, and the transparency is probably also as great as ever been developed. The one answer that I would have for that is for people who have had a known severe allergic reaction to another vaccine, which we call an anaphylactic reaction. And this could involve serious things like difficulty breathing or drop of blood pressure. Fortunately, those kind of vaccine reactions are very, very infrequent, very, very seldom. And the COVID vaccine has no more frequency of these severe reactions than other types of vaccines. So that would be the one really significant vaccine reaction that to look out for. And certainly for people who've had that type of reaction in the past, probably just talk it over with your doctor, see what they think about getting the vaccine.
We do know that in general, COVID in pregnancy has worse outcomes than pregnancy without COVID. And as a result of that, there are many OBGYNs who are recommending that their patients be vaccinated, but it really does need to be an individual conversation. I would just encourage people who are pregnant or who are even looking to be pregnant to have that individual discussion with their OBGYN, because it really is an important discussion that I think can't necessarily be made in a blanket statement until we have more data.
Autoimmune conditions are, relatively common. The things that I've read, for the most part, your neurologist or rheumatologist would say, yes, get the vaccine. But certainly if you have a concern, always worthwhile to bring it up with your physician, either your primary care physician or your specialist in that area. Yeah, you do not need to get a COVID test prior to getting the vaccine. The only caution there would be if you feel like you may have an active COVID infection, the types of symptoms that you've heard about for that, then please wait at least 10 days until after your symptoms have started and quarantine yourself in your house as has been recommended. We don't want people that may actually have an active COVID infection out in line trying to get a vaccine. But if you, once those 10 days are passed, over that quarantine period, by all means, please go ahead and get the vaccine.
One of the, again, common question I'm getting from my patients is, should I get an antibody test before I get vaccinated? Steve, what do you think?
Yeah, another good question on antibody testing, and I would say no. Even if you have antibodies that show you may have had a prior COVID-19 infection, we still recommend that you get the vaccine. I think as Jaylyn nicely answered earlier, that the vaccines provide stronger, more consistent immunity than just the infection itself. And so please still go ahead and get the vaccine. So I don't think an antibody test is really that helpful.
Yeah, I think that the CDC's made that pretty clear, that it's safe to get vaccinated without wasting the resources of antibody testing. Yep.
There should not be any cost to us as individuals, to you, for getting the vaccine, either for the vaccine itself, which the federal government is paying for, or there's an administration fee, which may be charged by, say, a pharmacy or the clinic or the mass vaccination site. The administration fee is covered by your health plan, and they will take care of that piece of it. So there should not be any out-of-pocket expense.
Yeah, it's actually really encouraging, I think, just to be able to have conversations with patients and let them know that it's fully covered. And so I think that it's amazing that we are able to give these out without any cost associated.
Now, follow up on that is the availability of the vaccine. And that's been one of the most frustrating things out there. And for people who are eligible for the vaccine, but having a challenging time finding that. So take advantage of those resources out there, both for your phase, whether you are eligible for the vaccine in your community, and then those other resources in terms of where you can get the vaccine and get that most effectively.
I have seen just in the last couple of weeks more availability. It feels like pharmacies are starting to get the vaccine. Smaller offices now have access to it. It's just, everybody needs to continue to be patient, and it's hard.
You can go to any vaccine administrator and you would be covered for that. You do not need to stay within a health plan given network. So there's that extra flexibility to go and get the vaccine where you're able to. In general, we would recommend that 2 weeks after your last vaccine, whether it's the Johnson & Johnson vaccine, the single vaccine, 2 weeks after that dose, or whether it's one of the vaccines that requires a booster, so 2 weeks after the booster, considered to be up to full immunity in that time frame.
I finished my series at the end of January, and it is so hard to wait those 2 weeks and not, go hug grandparents and see newborn babies and that sort of thing. But the 2 weeks really are important. So we got to give our bodies just a little bit of time to make sure that the immune response that we're creating and teaching our bodies is adequate. Once you are fully vaccinated, which means you're 2 weeks post the final vaccination, you are considered immune. And it's important to just note that that doesn't mean you'll never get infected. When we talk about immunity, it's just that your body's seen the virus before and it knows how to respond to it. Kind of like you know how to tie your shoes, you might know how to ride a bike. It doesn't mean you're not going to crash on your bike or that your shoes aren't going to come untied. It just means that your body's going to know how to respond. So the current CDC guidelines are that in the majority of situations, if you are with a fully vaccinated group of people, so everyone's completed their vaccine series or is at least 2 weeks post their last vaccine, that you can gather together unmasked. The guidelines also note that there is an opportunity to be unmasked with one low-risk single-family group. And the rest of us out in the community, a lot of us live in states where there are still mask mandates, and we're still encouraging people to follow those. But the good news is that when we are fully vaccinated, we can see each other again maskless.
I agree. We want to get out there and see friends and hug people and gather like we have in the past. And the vaccines are a really important part of that. And as Jaylyn pointed out, the faster we can all get the majority of us get vaccinated, the sooner we can get back to living life as normal and those things we've been missing for a while. The pandemic has affected so many different people in many different ways, and there's a lot of great opportunities for volunteerism out there, but some of the mass vaccination sites are really run by volunteers, and the volunteers have made a huge difference. So consider signing up for a mass vaccination site, and then just more generally consider how do I give to my community or communities of need. Consider the food bank or the local shelter or those other areas where we can all help out, and as a community can make a big difference on how we can help those folks.
I would just encourage people to just check on your neighbor. I think that it's easy to think big when the truth is that we really can make a huge impact just in the people's lives that are close to us. So check on your neighbor. Like that would be my pitch to volunteer in the community, that there's awesome opportunities that are huge and there's equally amazing opportunities that are small.
That's a great point, that often it could be right next door or just down the street, that a helping hand is well appreciated.